And here are my disclosures. I do invest in a number of surgery centers. So 7 years ago, I was asked to start a new joint program in Colorado. And in Colorado, you got to be a little careful with some of these terms because it can have a very different connotation out in the West. Even some of our patients have had a little bit of fun with this. So total joints have come a long way, and in 2023, we've gotten to a point where we can obviously do these as an outpatient. And in 2016, I was invited out to the Steadman clinic where they've been doing outpatient surgery for a long, long time and doing it very well. And we combined that with total joints. We had some headwinds in starting our program. It was a small little hospital. In 2016, the hospital did 80 joint replacements in the entire year. They only have 54 beds. We're at 8,000 feet. And about a third of our patients come from outside of the state or out of country. But we've gotten to a point where we're doing a high volume at a very high percentage of outpatients. So yes, it can be done. There's a lot of critical elements that you'll hear about on this panel today. But I would say probably one of the most important things is establishing your team. So how do you do 1,000 joints outpatients a year? Well, you got to have a winning team. So all of you have gone to medical school, residency, and fellowship to do this, only to find out that what you've really become is this. And you have to be a manager. So whether you call it a coach, captain, or leader, you have to lead. And if you don't lead, you will be led. And in some cases, it could be like the blind leading the blind. So yes, it can be done. There's a lot of essential team members. And I say that there's 3 phases of the game, just like in football. You have special teams, offense, and defense. I would argue that your 3 phases of your practice are administration, clinic, and your operating room. Just like many of you, you have a practice manager, a C-suite that directs the overall drive of your practice.